Well, there are a lot of things parents have to learn when they have kids, like when should you take your child to the dentist for the first time?
Or what are the best go-to snacks that won't cause tooth problems? Here to answer those questions and more is Dr. Joe Castellano, the president of the American Academy of Pediatric Dentistry. Thank you so much for joining us today. We appreciate that.
Thank you for having me. I'm glad to be here.
Doctor, do you think a lot of parents are just misinformed? And what's the number one thing you think they're doing, I hate to use the word wrong, but wrong when it comes to kids' health? Teeth health?
Well, I think there's a lot of information out there. We had a study conducted for us that showed that about 96% of the parents thought that oral health for their children was important, but we also did find that about 75% of those parents didn't take their child to the dentist by their first birthday, and about 30% of those parents didn't think that dental pain was a serious issue for their children. So we need to get out there and educate those parents, and I think probably the most important thing is to get them into the dentist by age 1.
I got to ask the question. I don't have children, Doc, so please forgive me, but all the kids, the teeth, they're going to fall out. Why would I care about bringing a kid to a dentist and when I know the teeth are going to fall out and then I got to worry about the second set?
Well, the teeth serve multiple purposes as they come in. They allow the child to eat properly. They also hold a space for the permanent teeth, and in some cases they help the child pronounce words correctly. Getting them to the dentist by age 1 is really important. It helps the parents establish a dental home, which is a home base for basically all things oral health. We get to establish a relationship with the parent, with the child. We get to educate them on the things that they need to do or the things that they shouldn't do to make sure that their child has a childhood that is free of decay and dental pain.
You know, when we grew up, it seemed normal to have a cavity or two or even more. And now dentists will tell you that if we're doing things right, kids don't ever need to have a cavity. Would you agree with that?
I would agree with that. You know, a lot of us think that dental decay might be genetic and, oh, my family had it, so I have it. But in fact, it's almost 100% preventable. If we do the right things, if we brush the teeth, if we floss, if we use fluoridated toothpaste and go to the dentist regularly, we can pretty much have a childhood that's cavity-free.
Your wife is a dentist, too. How often do you make your kids brush their teeth?
My kids brush their teeth 2 times a day, and even more if we felt that they had a lot of snacks or things that might be stuck in their teeth.
And talk about...
we recommend, the Academy recommends that children brush their teeth twice a day. For 2 minutes. I recommend to the kids, brush your teeth in the morning before you head out to school, and then again at night before you go to bed, and then any other time that you think that they could use the cleaning.
Talk about the snack battle. That sometimes, you're trying to really be great with the meals, but kids want a little something sweet for the snacks. What can we do to keep their teeth healthy and still keep them happy?
Well, the snacks that you really want to avoid are the ones that are high in sugar but that are also very sticky. A lot of the candies fit that bill, but other things that we might think that are healthy might not be the best options, like granola bars or fruit pouches or fruit roll-ups, because they're high in sugar, they're very sticky, and so that sugar sticks to the teeth for prolonged periods of time and increases the risk of dental decay. Things like and they're not as sweet, but fresh vegetables or even cheese are healthy options because they stimulate the salivary flow and kind of help neutralize the mouth acids that cause the cavities.
I often see kids sucking their thumbs, and I say, oh, that's a habit, they'll grow out of it, there's no big deal. But you say that you should really break them of this habit as soon as possible, right? That
is correct. We feel that if, parents should start working about 18 months of age to start working and breaking the habit of the thumb or the pacifier. Prolonged use of thumb and pacifier a lot of times will lead to bite problems or crooked teeth, and, breaking that habit early helps avoid any of those issues later on.
What about electric toothbrushes? Do you recommend them? My kids seem to like to brush their teeth more if I have them with an electric toothbrush.
Absolutely. Electric toothbrushes are wonderful, and a lot of the studies say that they're very effective and sometimes even more effective than the hand model. What's important is that the kids brush, and if that's what they like to brush with and that encourages the habit, then that's what you need to get for them. There's no substitute for brushing the teeth to keep them clean and healthy.
Is no matter what I do going to be prevented by genetics? Like I have bad teeth, my kids are going to have bad teeth, or that can be not the case?
No, that's not the case at all. Like I said, tooth decay is probably 100% preventable if we do the right things by brushing and flossing and using fluoridated toothpaste. So, just because you had them doesn't mean your child has them. If we do the right things, we can give them a childhood free of cavities.
We're almost out of time, but I got to ask you, do they need to floss every day, and should they use a mouthwash?
Flossing every day is optimal. For the first several years of their life, maybe till they're 8 or 9 years old, you need to watch them so make sure that they're doing it effectively, because the little ones don't really do a good job, and probably can't work the floss real well. Monitor that and make sure that everything stays clean.
All right, thank you, doctor. We appreciate that. I'm going to floss right here. You can't see it. I'm dancing.
You can't see him.
All right, for more information and guidelines from the American Academy of Pediatrics, head to aapd.org.
That floss is way more popular than the one with their teeth.